Welcome to this episode of the Biology of Trauma podcast. I am your host, Dr. Aimie. We'll be answering the following question. Can lithium influence nervous system dysregulation? In this episode, we're looking at lithium's role on the nervous system. You will find that it needs to be central to the conversation for mental health, addiction, and the trauma healing journey, particularly because of its stabilization effects on the nervous system. I have brought in a guest whose work I have high respect for and has helped me see the possibilities beyond mood medications for myself. This is Dr. James Greenblatt. He has been in practice since 1988 and is the founder and pioneer in the field of integrative and functional psychiatry. It was 2014 when I was in the middle of my general surgery residency, and I was on 2 mood medications for anxiety and depression. So when I came across Dr. Greenblatt's work, it was really with the lens of, I need to find some answers because my future is not looking very bright given my current health trajectory. And I knew that the conventional medicine that I was a part of didn't have the answers for me beyond take these pills for life. Dr. Greenblatt has been a leader with mood imbalances, and what I discovered next is why I want to share his work on lithium with you in this episode. Trauma creates lasting changes in our biology, which includes biology that creates mood imbalances. The healing journey is about helping our nervous system become more flexible, regulated, stabilized, and mine was certainly anything but that at that time. The result for me was that I even found therapy challenging because of the emotion it would bring up that my nervous system wasn't stabilized and regulated enough to contain. I would come home craving and foraging for carbs, binge watching movies to distract myself, and noticing the inflammation and brain fog take over my gut and brain. How we can come in and support the nervous system to be more flexible, to be more regulated, to be more stabilized, then is something that we want to talk about. And we're going to talk about the role of lithium in doing just that in this episode. You will learn about lithium's role in impulsivity, the interface between lithium and the immune system, the use of lithium for depression, suicidal thoughts, and addiction, why you should look at your family's mental health history prior to considering lithium treatment, what other symptoms might indicate the need for lithium treatment. You will also learn about the different forms of lithium and how lithium interacts with other minerals like copper and zinc. It is such a pleasure and honor to have Dr. Greenblatt here and to gain his wisdom of all the decades that he has seen patients. And I'm very excited for this episode. Let's jump in. So what role does lithium play in mood imbalances and the regulation and stabilization of the nervous system?
A good question. And the 6-hour answer is, it's vast. And just to put it in perspective, we're talking about an element, in the periodic table. It's a nutrient in the Earth's crust, and it's required for optimal brain function. So I think, it's not the medication, because those are very, very high doses of this natural element. And again, what we have found over many, many years of research, that this element in these microgram doses, what we would get in our food or water supply, has tremendous, use the term stabilizing effect on brain function. And like every other micronutrient, different individuals have different requirements for this trace mineral. And we can talk about that, but the core function is absolutely controlling, regulating, and kind of inhibiting lots of impulsive behaviors that can get us in trouble.
So tell us more about that impulsivity. How does lithium play a role in impulsivity?
Well, I think some people believe this trace mineral, and even as a medication, direct action in the brain is to inhibit some of these activating neurotransmitters. So, and the clinical reality to that is that lithium in microdoses and prescription doses is anti-suicidal. So it's traumatic. We know that it can inhibit that. It is anti-aggression. So we know it can inhibit that behavior. Addiction. We know it can inhibit and control addiction. So on the microscopic level, on the clinical level, in microgram doses and high dose prescriptions, lithium has a very profound inhibiting behaviors and controlling impulses. And for trauma, I think it just is critically to understand that.
Now, when I think of activating neurotransmitters, I'm thinking of glutamate, for example. And GABA would be the neurotransmitter that we are told is the calming and the antidote to glutamate. Is lithium involved in any of those neurotransmitters, or is this really outside of the neurotransmitter mechanism that it's doing its own thing to kind of calm down and decrease the reactivity of the nervous system?
Yeah, as an element that's so important for many thousands of reactions in the brain. We do know that absolutely, as you described, lithium inhibits glutamate. Lithium enhances GABA. And what's fascinating, I've used the term adaptogen because, drugs only work, one way. But lithium actually works for any of the neuroscientists in the room, actually in the presynaptic and the postsynaptic neurons. So it's just this regulating effect to perhaps modulate might be the better word, neurotransmitter activity, but it does tamper down glutamate.
So why would it be helpful for those who have suicidal thoughts and ideation?
We don't know. Impulsivity is the one that screams out, but we know the research is extensive, and it's very frustrating to me with such a robust we should go back 40, 50-year history of lithium being anti-suicidal, that is not just more commonly discussed and used. So prescription lithium, absolutely been shown to be anti-suicidal. But then we have studies around the world from hundreds of countries and meta-analysis with millions of individuals. And the same thing from Texas to, I think one study was Albania, lower amounts of lithium in the drinking water, in the tap water. And nobody's drinking tap water, that's another story. The lower amounts of lithium in the drinking water is associated with increased suicide, completed suicide in those communities. And those communities that had higher lithium, protective for suicide. And we know one of the most significant risk factors for suicide is trauma and the, consequences of inflammation in the brain.
Inflammation in the brain. That's a topic that I talk a lot about because of how closely associated it is with the trauma response. How is lithium involved with the brain inflammation?
Well, once you start asking questions, it gets to be this too good to be true kind of a molecule because it just goes on and on. But lithium has profound anti-inflammatory properties. There's research on viral infections and COVID, actually, and herpes virus. So we've had a literature on both an pure anti-inflammatory effect as well as some specific antiviral effects.
So this isn't then just brain inflammation. It sounds like it's also other forms of inflammation in the body, just the immune system. Lithium may be a general support for the immune system.
Correct. Absolutely.
Wow, that makes a lot of sense because as I look at the impact on the immune system and the nervous system, they are so closely connected. And the impact on the immune system when the nervous system is in stress or chronic trauma, being able to have tools that help repair the immune system are going to be some of the most important ones that people can take. I know that in my latest conversation with Dr. Jeff Bland, he was also talking about some new supplements and tools that can really reverse some of these effects on the immune system that are driven by the dysregulation in the nervous system. So this is starting to sound like a too good to be true kind of element.
I mean, the more we use it clinically and the more doctors we train, it just is really probably one of the most gratifying, interventions I've used in my practice, from 4-year-old kids to 90-year-old adults.
And you're also using it for depression. Are you reserving it for treatment-resistant depression, or are you just jumping in earlier than attempting other treatments when someone presents with depression?
Yeah, I mean, I think there's a subtype of depression that responds very well to lithium. And again, in college, when I was doing all this reading, I don't know if you know Jonathan Wright, who was the grandfather of all this integrative medicine, but he wrote about lithium, and I read something at that time that's been clinically incredibly helpful, that those individuals with a family history of depression, addiction is probably the most common, aggression, or bipolar illness are the individuals that respond best to lithium. So if someone has depression and they have a family history of addiction, they have a family history of aggression or violence, or those individuals respond best to lithium. The subtype of depression, it's usually with the symptom of irritability. So irritability is probably the most simplified description of a symptom of what I would call lithium deficiency. So chronic irritability with that depression, again, is a indicator of a good response.
And so if you have a patient coming in, who is that patient? What are their characteristics? What is their history that would tell you this is an ideal patient for lithium? Who is that patient for you?
Again, the family history is critical. And I think as medical professionals, we don't ask enough about a family history, and mental health professionals, we do it too quickly. But a 3-generation family history is going to be really important. So I want to know, has there been struggles with depression or mood lability or addiction? So that's number one. Number two would be, we often do testing. So we can look at hair testing, trace mineral hair testing, can look at lithium levels. And then the third, as I described, is that symptom of irritability, often associated with kind of moodiness and mood lability.
Now, as you describe some of these things, I also start to think of copper, and copper excess can contribute to mood lability. I also think of zinc and zinc deficiency and how common that is and how dysregulating that can be for a nervous system. Do we know how lithium interacts with copper and zinc in our brain and nervous system?
We have bits and pieces, but you're absolutely right. If let's take a 12-year-old. So an irritable, angry 12-year-old, you're absolutely right. It could be high copper, low zinc. It could be the genetics and low lithium, or it could be both. But the only way we can really sort that out is with, testing. And it would be the same for a 42-year-old adult. Not everyone who's irritable has low lithium, but there are other causes. And that's why the testing is such an important part of the work that I do. So we cannot just guess, that we can really, have a path to helping our patients.
And do we understand the mechanism by which lithium helps an addiction process? Or what are your thoughts about what that mechanism might be of why it's so helpful for those with an addiction?
Yeah, we don't, again, we have lithium doing things to neurotransmitters and doing things to cell membranes and second messengers. And so we don't know, what 1 + 1 equals, but the clinical results are pretty, outstanding. And, I do think that common theme is this being able to, one, control the mood lability. So for addiction, if we're irritable and angry and our moods are all over the place, thinking of something to calm us and self-medicate is going to be usually the drug of choice. If lithium can stabilize that mood, it's going to be much easier to abstain and get treatment.
Yeah, it definitely is the truth that an addiction is just an attempt to soothe the nervous system and have it not be so, whether it's sensitive, reactive, whatever it's feeling at the moment, it's just too much to feel that at the moment. And so to be able to have a tool that comes in and just stabilizes the nervous system, takes away that, whether it's restlessness or the irritability or the impulsivity, what an amazing tool that practitioners can use. So lots of people can be walking around with a lithium functional deficiency, and it can be a combination of they're not getting it in the water for various reasons. I'm assuming food and a lot of the food production processes are probably depleting our food of that element. Do you know of any foods that are high in lithium naturally that might be sources for people to consider making sure that they get enough of?
The U.S. Geological, Society, people can look up the amount of lithium in their tap water. And there was a psychiatrist who had all this data on his website at one point. So that's available. It's not heavily in our animal products or vegetarian products, small amounts. And I haven't seen, but some botanists said that the highest concentration of lithium in the food supply is in the herb thyme.
How very interesting. I know that thyme also has a lot of gut health properties and even antimicrobial to support a healthy microbiome. So very interesting that thyme also has higher elements of lithium. So stepping back, looking at brain health in general, it seems that brain inflammation is a really important thing for people to know about and to address for their overall brain health, whether it be mood or Alzheimer's. Would you say that that's one of the most important ones, or just for a person's overall mental health? What would you say here are the most important things for people to know and to pay attention to?
I think the most important thing that I've learned and relearned every day with a patient is, this concept of biochemical individuality, or how unique, we each of us is. And that uniqueness, extends beyond our psychological, journey or our stress journey. It's our biochemical journey. It's our genetics clashing with our environment. And whether that was nurturing or stressful, it just creates its own kind of environment. So unless we take a close look at what's going on to that individual, I think healing and recovery is just prolonged. So looking at that individual framework, does someone have celiac disease, unrelated to the trauma, but impairing their absorption of micronutrients? Does someone have a B12 deficiency, or does someone have a higher need for, magnesium? All these kind of core micronutrients, I think, are foundational. I think lithium, and so to understand that about yourself, I think is the first step.
So I'm imagining someone entering maybe an addiction treatment center, or maybe they're coming in for trauma therapy and they're starting that process. It sounds like this kind of analysis of their micronutrients, of their absorption, of their inflammation would be a really helpful profile to have in order to help their healing process. Because if I understand you correctly, you see those things as really slowing things down and making the change in their nervous system slower than what it needs to be.
Absolutely. I mean, we have a term in psychiatry, treatment-resistant depression. Someone has treatment-resistant depression. we're essentially blaming you. You have treatment resistant. It's your fault. We're not getting better. And the numbers are staggering. It's like 35% of people and that we keep throwing different medicines at. And, being in the field for so long and testing these people with treatment resistant depression, we always find out why. I mentioned they have celiac, they're not absorbing the micronutrients. They have a vitamin D of 10. They have a genetic variant for folate, MTHFR. There's always something blocking that path. And our current psychiatric model doesn't address it. But functional medicine can. And whether it's addiction or trauma treatment, understanding those kind of broken pathways to optimal health are really critical.
Mm. And so let's just focus for a moment on the addiction treatment itself. Given what you know about addictions, would you think that everyone coming into an addiction treatment center would benefit from low dose lithium, or not necessarily? It's not global to an addiction process. It's only going to be some individuals in an addiction treatment center that might benefit.
Well, let me go back and just share what you brought up, addiction, that, doing these tests for 100 years, thousands and thousands of patients. Our patients with addiction usually have the most significant biochemical abnormalities. So, with a depressed patient, they might get one problem. With our addiction patients, you're empathic, they're just biochemically very distorted. You have so much more empathy for why they're using these substances. So, but in terms of lithium, we've actually done that study, and I would absolutely recommend everybody in treatment for addiction to get low dose lithium. I mean, it's one of the few absolutes about any micronutrient that I would say, other than maybe magnesium. And they did this study. They used low dose lithium in a residential program in New York. There's prescription lithium, but it was low dose, 150 milligrams, and dramatic improvements in recovery rates, less medication, better completion of the program.
So as we look at what we know about lithium, it seems like this should be a tool for everyone who's working with mood disorders, trauma, chronic stress, addictions, and knowing the research and what is helpful and safe for people and the dosages. When you think of what is in the research, you had mentioned the suicide, you had mentioned the Alzheimer's. What of in the research do you find the strongest, and what makes you the most excited about what is possible for the future in bringing lithium in?
Yeah, I mean, I think clinically, it's at low dose, 2 to 10 milligrams for irritability and aggression and mood lability. And that's both for kids and adults. And, you mentioned mood lability and impulsivity. You quickly go to a diagnosis, very, linked with trauma, is borderline personality disorder. And that gets to be a label that's, people aren't looking at the biochemistry. And we found tremendous benefit from other micronutrients like omega-3s, but also lithium. So it's critically important to understand that. But we don't have a good research to support that, 2 to 10 milligrams for irritability and impulsivity. The research, which is staggering and overwhelming, is in the anti-suicidal properties and in the prevention of dementia. We also have research. I mean, again, it gets to people looking at Parkinson's disease, looking at ALS. There's a grant that a neurologist just got in upper state New York for looking at low dose lithium for Parkinson's. There's been studies going on 10 or 15 years. So lots of research around these kind of neurodegenerative illnesses, but clinically, there's just not as many people talking about it. It should be.
And why not?
Because it's too simple. It's inexpensive. You can buy it over the counter for pennies. It's just not going to be in the medical literature, and it's not going to be a research focus because our research is driven by, pharmaceutical dollars.
And this could be a solution that would negate some of the need for the other medications that the pharmaceuticals make.
I mean, think about the kids or the elderly being placed on 2, 3, 4 psychotropics, and some, people would believe that's safer than, a micronutrient that often could do the same thing.
As we wrap up, is there anything that I have not asked you that you would want to share?
No, I think we hit, most of it in small amounts. I think it's very safe. I think as we get older, I certainly would read about the prevention of dementia literature. And then the caution is not everyone who's angry, as you described, is got a lithium deficiency. So that's where we need to assess the individual and treat based on that kind of personalized assessment.
Well, thank you. Thank you for coming. Thank you for sharing yourself with us. Thank you for the work that you've done over the decades now. And I look forward to seeing you again. Thank you for tuning into this episode of the Biology of Trauma podcast. As I say, trauma becomes our biology, not just psychology. And then our own biology can create ongoing dysregulation. Our own biology can contribute to the frequent overwhelm in our life. And lithium could be a biology repair tool on the healing journey. If you are curious to learn more about how biology and biochemistry impact our trauma responses, reactions, and mood imbalances, then I have resources for you in the show notes. There are 3 most common biochemical imbalances, and I have a guide for you on this. I see these 3 biochemical imbalances so often in those who are stuck in their reactivity, responses, and moods imbalances that I have put together this free guide to explain them and help you know if you might have one or more. To give you context, I had all 3. Learn the common traits and solutions for testing if you think you might have one of these biochemical imbalances. I also want to share with you top 3 nutrients for tackling brain inflammation. And I have a free guide for you that will teach you about 3 biology repair tools for brain inflammation when you feel the fog and the decision fatigue coming on. I want to share with you vitamin D as well, because vitamin D is a powerful repair tool for inflammation and a dysregulated immune system. It gets used up in times of stress and yet is needed for both a healthy gut and healthy brain. And I would want you to consider testing and being on a vitamin D supplement. There are related podcast episodes, and I really am going to take you to the ones that I've done with Dr. William Walsh, who is the pioneer in working with the biochemical imbalances and who I learned them from him. And so episode number 6 was on the role of methylation in epigenetics and mental health outcomes. And episode number 7 was part 3 with Dr. William Walsh, and it was on identifying and treating copper excess to reduce postpartum depression. I have a few YouTube videos that you might be interested in. The copper to zinc ratio, what do you want for the trauma healing journey? And the first oral medication for postpartum depression is out. And is it worth it? I have a video on that. Finally, if you could please take a minute to leave a review for the Biology of Trauma podcast. As you know, I am here to save you time and money by bringing you practical information that will help you accelerate the trauma healing journey. Your reviews and feedback are how I know how to improve this podcast and bring you great content. I'm your host, Dr. Aimie. Until next episode, lots of love.